Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital of Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. Thank you.
This video is about colon disease and colon surgery. What is the colon? The colon is the large intestine. We have about 5 feet of colon after our small intestine. There's the ascending colon on the right side of your abdomen. There's the transverse colon, which traverses your abdomen. There's the left colon, which is the descending colon on the left side of your abdomen. The sigmoid colon, which looks like an S. And then this ends up in the rectum, which is the reservoir where your stool is stored. The colon's function is to absorb water, electrolytes, and form the stool so that you can have a bowel movement. What are the surgical diseases that we see in the colon? We can see, of course, colon cancer. We can see diverticulosis or diverticulitis, which are outpouchings of the colon, which can become inflamed and are subsequently called diverticulitis. We can see inflammatory bowel disease, things like ulcerative colitis and Crohn's disease. And we can see blockages of the colon, which obviously could be from scar tissue or even tumor. What type of surgery is performed on the colon? Well, the colon is removed in segments. You can have the right colon removed. If you have a tumor or a large polyp, the right side of the colon is removed and the small intestine is connected to the transverse colon. You can have the left colon or the sigmoid colon removed because that removes the left side and it connects it to the rectum, which is the reservoir. And then you can have your entire colon removed. This could be done because of underlying inflammatory disease of the colon or multiple polyps throughout your colon. We perform robotic surgery to remove the colon. This is minimally invasive surgery through small incisions. It's beneficial because the incisions are small, leads to faster recovery and more precision on complex surgery, leading to less complications for the patient. These operations are done through small incisions. We remove the right side or the sigmoid or the left side, and this will be particular to your particular operation, which I will discuss with you. We remove the colon with a small 2-inch incision from the body, and obviously you recover in the hospital. Colon is not a clean organ. It has bacteria and stool in it. That's why you have to take a preparation and a cleansing prior to the operation. So complications can occur after colon surgery. Infection is common, 3 to 5% after colon surgery. Bleeding, because we're connecting the colon and cutting the colon, 2 to 4%. Leakage of where the connections are performed, 2 to 5%. And then obviously sleepy intestine can occur after surgery as well, 10 to 15%. So what is the typical recovery from colon surgery? It could be 1, 2, or 3 days in the hospital to recover from the actual operation, 1 to 2 weeks at home to recover to get back to office work, and then total recovery from colon surgery usually takes 1 month. Colon surgery could be very overwhelming, but there are modern robotic techniques that allow patients to recover well and regain normal function. Understand the underlying disease that you have and the reason you're having colon surgery, and then be confident and be prepared for a safe and successful recovery.